Hey guys, we're here to talk to you about iontophoresis. We got me, Zach, and Kayleen coming to teach you all about it. And what iontophoresis is the transfer of ions. So, in our setting, that's going to be delivery of ions through the skin using an electrical charge. So first, we're going to have an electrode pad and some medication, but we need to know the charges of them, because as we all know, opposites attract, but we want to repel. So if you have a positive medication, you need to have a positive charge through the electrode pad to be able to repel and drive the medication into the skin. And it helps because it's localized. To do this, we're going to want to use a direct current, because if we're using an alternating current, then it'll attract and repel, but we just want the repel. So as it's driven through the skin, we're going to be using a power source called a dose controller, and that's going to be able to control the dose, the current, and the duration of the treatment, all while monitoring the skin and turning off and on when as needed.
So there are some factors that will influence the treatment. So first is how you want to know how deep the injury is. With iontophoresis, you only want to use a depth if the injury is between about 6 to 20 millimeters. So anything past that, the medication probably won't get to. And then another thing is if there's a lot of local vasodilation, that will affect how deep the medication will go. So a trick before applying the treatment is to ice before, which will cause vasoconstriction, which will then help the medication be able to get in further. So the indications for iontophoresis will be different based on the medication you're administering. So those could range from anti-inflammatory to edema or scar tissue, or like used for bacteria or fungus. So it really just depends on what your goal is and what medication that is associated with. And then also just as an overall indication, it's an alternative rather than having to do a needle injection or take a pill. So the drug dosage calculation, so the dosage equals the current times the treatment time. And we are going to show you a chart of all the medications used, their dosage, and the associated goal.
So before you start treatment on your patient, you want to make sure that you screen the patient for contraindications and precautions. Contraindications include patients who have an implanted pacemaker, have open wounds on the treatment area, and drug allergies. Also, you don't want to do the treatment over the transcranial area or the orbital region. You want to be cautious of patients who have impaired sensation, recent scar tissue, exposed metal. However, it is safe to do this treatment over a metal implant.
So before we start our treatment, we're going to screen for contraindications, precautions, and explain to the patient what it's going to feel like. So before we place our pads on, we want to clean the area where the pads are going to be applied. And then we will inject the pad with the medicine. So the medicine will go right in the middle pad, and then that will go onto the skin. So now that we have our pads placed, because we're using saline, which has a negative polarity, we're going to hook up the negative to the medication pad and then the positive to the other one.
First, you want to turn the unit on. Since we're using saline, we want to make sure that the dosage is 40. So we'll turn the dial to 4. Then we'll tell the patient that the treatment is beginning. Then we'll adjust the intensity according to the patient's tolerance and the dosage needed. We'll continue the treatment for 10 minutes.
So when the treatment is over, make sure to turn the machine off, and then we will disconnect these. And then we'll take the pads off and check the patient for any adverse effects, any rashes or anything on the skin. Ask them how it felt, if we need to change something for next time.